Hi, my name is Elizabeth Paranzo. I'm going to do my presentation today for my final project. I've created a presentation that's going to summarize the portfolio and work that we've completed this entire semester. I chose functional communication training. So today I will walk through this key research with you guys, the concepts, the strategies, the ABA literature, and give you a clear understanding of how FCT is used to support individuals with autism. Okay. So, our portfolio that we're going to discuss today is based off of the work that we completed. So, I completed a literature review on the efficacy of functional communication training for students with autism spectrum disorder. I did the school training assignment as well on FCT interventions and the advocacy letter assignment based off of funding for FCT interventions to utilize in the school district. And finally, we have the behavior plan assignment, which I also used FCT as the form of intervention to treat self-injurious behavior. Okay. So we're going to talk about functional communication training and the research that I've done an extensive amount of research throughout the semester to learn more about functional communication training. And there is an evidence-based differential reinforcement procedure in which a functionally equivalent communication response is taught to replace challenging behavior. And we know now that that is from Carr and Durand, 1985. So FCT requires identification of behavioral function through functional analysis prior to interventions to ensure that communication responds directly in context of reinforcement. So we teach a functionally equivalent communication response to replace that challenging behavior. This is designed to replace the challenging behavior with an appropriate communicative response. Okay, we're going to go a little bit more into this. We have more on Carr and Duran in 1985. I hope you see that. Okay. So functional communication training originated with Carr and Duran. The authors had showed that many challenging behaviors in children with developmental disabilities were linked to limited communication skills. So teaching a simple function-based communication response led to a significant reduction in problem behavior, which was huge. So the study specifically included four children who displayed severe disruptive behaviors maintained by attention or escape. So after identifying that the behavioral function was what it was, the researchers thought, okay, let's teach a simple, more appropriate request that allowed the children to access the same reinforcers. So FCT ultimately reduced the problem behavior across all of these participants. Furthermore, um, we really focused in on that functional analysis here. So now as we keep going and learning more about FCT, we're identifying the maintaining reinforcer. We're teaching simple functional communication responses, reinforcing immediately, and using extinction only when appropriate, right? We want to make sure that it's ethical and that we're using other options before that and we have the right supports that implement that effectively. And Wida at all discussed that, really focusing on the functional analysis portion of that and like the relevance and determining what that function of the behavior is because we are doing a function-based intervention with FCT. Okay, so over time, FCT became the core ABA intervention, supporting extensive evidence demonstrating its effectiveness across the home, school, and clinical setting. So this research right here is really great because it started that foundation of like how do we actually implement it? How can we replicate this? So FCT is commonly integrated in the primary replacement behavior strategy within a behavior intervention plan. So behaviors maintained by attention, escape, or tangibles really benefit from this sort of intervention. Really treat that. Okay. So here we have research from Hagopian et al. 1998, where FCTs under different treatment conditions in an inpatient unit. Okay, so the participants, 21 children and adolescents ages 2 to 16, diagnosed with ASD, intellectual disabilities. So the behaviors included aggression, self-injury, property destruction, pica, and elopement. All these participants first completed the functional analysis, which is what we discussed before. We need to make sure we know the function, right, before we're treating anything. Um, which they state that they have, and sessions were about 10 minutes, occurred multiple times a day. And then they compared the FCT alone, the FCT plus the extinction, the FCT plus punishment components. And what they found was it was effective, right? But the strongest and most reliable behavior reduction occurred when FCT was combined with extinction or carefully implemented punishment procedures, which we touched a little bit on. We got to really be careful with that. Make sure we're doing this with enough support and we're following those BACB ethical codes, right? We want to make sure if we're using any form of punishment procedure and an extinction, we really are doing it accurately with procedural for fidelity, of course. But they did note that, which is interesting. Okay. So right here, this is what this research is really great because it shows us that we can actually utilize FCT remotely, right? So this was a big thing during COVID. We had to do a lot of our sessions remote, which was out of this world. I know for me, my experience with that was it was really cool. You know, it really um showed for my clients to be effective, and this article pretty much matches that, you know. Let's move on. It says telehealth, right? So examining whether the parents could successfully use FCT with coaching delivered through telehealth, which, if you guys experience this too, it's the same as having that parent training session in the middle of COVID, trying to get that caregiver to really increase communication skills. And we're using functional communication training a lot of the time with our kids, right? So through this coaching, they were able to do it. And there were 17 children and they all had ASD. They did show aggression, self-injury, property destruction, and noncompliance, which, you know, shows this is a great treatment for them specifically, right? The parents attended sessions at nearby clinics while consultants coached them live from remote sites. And very interesting. So they used non-concurrent multiple baseline design, of course, participants. Okay. So the parents first completed the remote functional assessment, then they used the function-based the FCTs to teach alternative communication. So the clinic's assistants were there for safety material support that was beneficial. The problem behavior and the communication were measured in 6-second partial intervals, and the IOA was above 97. So the results show that the problem behavior dropped by an average of 93.5%, which is significant. So parents carried out these procedures with strong treatment fidelity, showing that in-person services aren't always necessary for effective ABA intervention. And this is really great to know because we have so many kids that cannot access supports and services for whatever reason that is. They just can't get there. I don't know. But you know, this is good to know. Okay. So now we're going to move on to discuss the challenges for individuals with ASD and how this is going to relate to FCT specifically. So they have difficulty initiating communication and expressing their needs, limited verbal, nonverbal repertoires, we know that, low frustration tolerance, difficulty with delays, challenging um, generalizing skills. It's challenging to generalize the skills across settings and the prompt dependency affecting independent responding. Okay, so now how does this really impact FCT? Well, it does because FCT is communication training, and a large part of the disability is deficit in communication. So we have to really work around all of this and support these individuals very specifically, and it has to be very geared toward individual clients. Okay. And we have the challenges in school and community settings. Okay. So here we have the therapist and we have a student functional communication training and they're doing therapy, but that's not really how it is, right? Not all the time. You're not really sitting at a table, show me Apple all the time, right? That's not always realistic. So the barriers we have here and we see is like inconsistent staff implementation, which reduces the treatment fidelity. And competing academic demands limit immediate reinforcement. So if we're not getting that immediate reinforcement, what are we learning? We're learning that we're kind of getting a reward for something that we maybe not at the right time. That definitely affects our learning and what the student is actually learning from the experience. So high staff turnover, that disrupts intervention continuity. Yeah, that's a very big thing with especially in this field with the turnover. Limited reinforcer availability in structured settings. So that's another thing. If we're doing functional communication training and someone's asking for something and we don't actually have that, that is going to hinder our learning too, the availability. And if we're in a structured setting, we can't do that. We can't always meet them where they are. We can't really implement it in the way that it's supposed to be. So we have to work with that. And the environmental noise and transitions increase problem behavior, of course. Okay. So moving on, where skills lacking in this area. Okay. So functional manding for attention escape, tangibles, and sensory input. Discrimination of reinforcement availability. Tolerance skills for waiting and transitions. And then peer-directed communication skills and generalization of communication across people and materials. So these are the skills that these prerequisites that we really are like working with. We sometimes we need to really you have a situation here like where the tolerance for the skills for waiting and transitions are just not there. They're just not there. And we need them to be there, but they're not. So we have to work with that individual differently, right? Um, but that's okay because we can definitely gear it towards them. That's what's so great about FCT. It's really tailored towards the individual client. Okay. Okay. So now this is important. So what needs to be taught? Now, a simple FCR aligned directly with behavioral functions. So that is going to be the functional communication response, right? That we want. And we're going to align it directly with the behavioral function. And that's how this really works because it's tailored to the function, what the purpose, what they want, what they're trying to get. So the tolerance responses such as waiting or accepting delays, though that needs to be taught. Definitely needs to be taught. Discrimination training across contexts and partners. Um, so we find that discrimination training is something we need to focus on as well. Um, with these clients and generalization to peers, caregivers, teachers, and community settings. So this is a big one also because sometimes we don't get to this point. We don't get to see them off, right? We're not really sure. Is it getting past maintenance? Are we going to generalize this? Um, are we going to get to that point? We don't know. Sometimes the turnover rate, even with our own clients, right? But this is a very, very big thing to get the caregivers, teachers, and community workers to also implement FCT in the same way so we could really generalize to other settings and people. So independent mans without prompt dependency is also pretty big too. We need to work on that. These are all things that we can teach. And these are things that we can work on in a very specific intervention for our kids or clients, adults, whoever is receiving services. Okay. So the importance of teaching these skills. So FCT is super, super important, especially in the field of ABA and for our kids and adults with autism, because it's functional communication training. We're teaching them to communicate functionally and to access what it is that they are motivated to get, want, talk about, receive, however you want to put it. This is something that's highly motivating. So we have a lot to work with, and it can really like reduce problem behaviors and overall improve quality of life, which is huge. So this is another big reason I picked this topic because I think it is so purposeful for these clients. Um, and Carr and Duran in 1985 discuss how it reduces severe challenging behavior. And when we're working with people with this population, you want to ask yourself, well, why am I so interested in working with this population? What is it that I want out of it? What is it that I want to do? Right. And for me, this entire lecture right here is just is showing that this is the treatment we're going to use to assist with these severe challenging behaviors, and it works. So increases access to academic and social opportunities, great. Improves independence and adaptive functioning. even better. Supports peer engagement, social interaction, which is huge for, our individuals with autism. And it enhances long-term communication competence. Okay. So effective teaching strategies we want to touch on. So the conduct functional analysis prior to teaching FCR. Oh, sorry, to conduct it, the functional analysis. So we touched on that a couple of times. We're going to touch on it again because we want to make sure we know what the function is before we're doing any form of interventions. We need to know that we're actually treating the right function and that we're implementing this treatment correctly. And it's so important that we really have that data to be able to say, okay, this is what the function is, so this is what we're going to do. Um, and immediate consistent reinforcement for FCR. Huge. Using prompting, systematic fading to avoid dependency. This is also very big. We want to make sure our BACBs supervisors are really helping out with our RBTs or teachers, whoever it is that's implementing it, to make sure that we're fading things out effectively and at the right time. Okay. And we're going to use prompting, systematic fading to avoid dependencies, which said that. Reinforcement thinning. Okay, this is huge. So we touched on that a little bit. Hago Payan et al. 1988, I'm sorry, 1998, discussed the reinforcement thinning using multiple or delayed schedule. This was huge. They found that the reinforcement thinning really, really helped with teaching FCT and program generalization systematically. So this is another thing. We talk about like generalization. We want to make sure that it's not random. Everything has to make sense. It has to be monitored. Data collection procedures needs to be in place. We need to train our staff. We need to train our teachers. We need to train our family, our caregivers, our community workers on how to monitor it so we can work with the BCBA to monitor and just make the right change for our client based off of, a data driven decision. Big. Okay. So now we have and effective teaching strategies. So this is important to note, right? So teaching FCR without identifying the behavioral function. Again, we touched on that, but I'm saying it another time for you guys because this is huge. We want to make sure we know what the function is and that we're doing it correctly. So selecting the communication responses that are too complex or effortful. So that could be hard too, because then you can have somebody, a child or an adult, whoever is getting the services, it's too hard for them. You need to take it back a notch, or maybe it's too easy, There's so those are important to pay attention to. And then intermittently reinforcing the problem behavior. Like we don't do that on purpose, right? But we want to be mindful that we're not doing that. Um, and then, like we said before, the failing to feed the prompts leading to prompt dependency. We don't want that either. And ignoring generalization and failing to train across settings. So again, we want to make sure we finish this out thoroughly and we get to that point where we're working with our clients working with another member in the community or another therapist or another cousin or caregiver or peer, and they're able to do the same response and communicate functionally, not just in the presence of us, right? We want to make sure that that is generalized. Okay, some considerations and disadvantages. Okay, so this requires consistent implementation. So this is a very heavy intervention. It's repetition, consistency across environments. Um, Extinction may lead to the burst of emotional responding. We know that. So that's challenging too. The high density of reinforcement may strain classroom logistics. So it's like, is this really functional for the classroom setting? And with our, training assignment we did earlier in the semester, we did touch on that, and there are ways around that, right? So we can do, the environmental modifications. We could do so much with that, but it is something we want to be mindful of to make sure it's a realistic goal. This requires ongoing training, performance feedback, and reinforcers. We talked about that too. Okay, so this is a huge benefit for students. Reduction in challenging behavior, of course, increase independence. We want that autonomy for our students. The socialization is huge too, especially for autism, for that deficit, the communication and socialization skills. We want equal access, right? And enhanced quality of life. So this is great. It provides all of that and more advantages of FCT. So there's so much support, like empirical support, evidence-based, decades of research, and we don't find that often. So if we're trying to implement something on maybe self-advocacy, we're not going to find that kind of research yet. Maybe hopefully soon, right? But not right now. Right now, we're going to find everything on FCT because this is a long history of intervention, integrating into the behavior intervention plan, the ABA protocols, and it's really, like we said, effective in severe behavioral um, cases when implemented with fidelity. We see success. Okay, so as we were talking about the training assignment, um, just now, the school training assignment. So let's do an overview of that now. Um, that was huge because we've got the opportunity to really practice how to train our school staff on this stuff, right? So I gave examples of non-examples, communication strategies, reinforcement procedures, and really got to kind of explore that, which was very insightful. Okay, and then we also utilize this behavior plan assignment, right? So for this, I chose somebody specifically that had severe self-injury behavior because, like we said, with FCT, that's what we use it, right? We're going to see those results. We're using it with procedural fidelity, and we did. So that the behavior intervention plan developed, it showed the mastery 90% independence across 15 consecutive sessions and generalization across peers, settings, and materials. Okay. And like we said, so FCT is supported by research, is effective intervention for decreasing problem behavior and increasing communication. So we were able to really I was able to explore using the PECs and how to improve functional communication with the peer interaction and play skills, getting that feedback from my professor and getting to change things up a bit, and just using the research I've done all semester to kind of make this a real intervention plan was really effective, I think. The advocacy letter assignment. We're going to do a little summary on that as well. That is part of our portfolio too. So advocacy is huge for the population that we're working with, for especially functional communication training. I mean, we are really utilizing our advocacy skills daily when we're providing those interventions because we're assisting and supporting individuals that cannot communicate functionally, and we need to really support them and by working on their interventions, their goals, and making as individualized as possible, we're advocating for them. We're giving them their voice so they can advocate for themselves. So through that assignment, I was able to request for funding for FCT to be utilized in a school district. That was really cool. Also to see the other end of that, and to get that feedback from my professor. Okay. We're able to kind of train the teachers or give them the information in the letter that we would then train in the school training assignment. And there are so many ABA principles embedded in FCT. Okay, so reinforcement, establishing FCR is efficient alternative. DRA, extinction for problem behavior when safe, right? We want to make sure always talking about that punishment procedures, prompting, prompt fading strategies, generalization, programming across stimuli and contexts. Okay, so this is all ABA right here, and we see this all the time with FCT. Okay, and I have my references right here. Okay, and overall, this was a very informative assignment, and I think I personally benefited from having this one topic the whole semester to kind of guide me through my assignments, my research, and then put it all together. And I feel much more confident on this topic, and I'm very excited to implement these interventions more frequently. Now that I have so much more information and experience. And thank you for listening, and we're going to end right here.